is an introduction to hypertension. In this video, we will learn the risk factors, the complications and types of hypertension, the treatment thresholds, the blood pressure treatment goals, and some of the major classes of antihypertensive agents that are used for the management of hypertension. Cardiovascular disease is one of the leading causes of death globally. Some of the major cardiovascular risk factors include obesity, physical inactivity, diabetes mellitus, dyslipidemia, family history of premature atherosclerotic disease, kidney disease and hypertension. So hypertension is one of the significant risk factors that causes increased mortality and morbidity, and this results from damage to the blood vessels resulting in end organ damage. So let's see some of the complications of hypertension. Sustained hypertension can increase the workload on the heart, and this increases the chances of heart failure. Damage to the coronary blood vessels increases the risk of coronary artery disease. Damage to the blood vessels of the brain increases the risk of stroke, that is ischemic or hemorrhagic stroke. Damage to the retinal blood vessels can cause vision problems and in severe cases can even lead to blindness. Damage to the blood vessels of the kidney can cause kidney dysfunction, which can also lead to kidney failure. Sustained hypertension can cause damage to the peripheral blood vessels, which increases the chances of aneurysm and other vascular disorders. How do we define hypertension? Hypertension is defined as elevated systolic blood pressure, diastolic blood pressure, or both. So what is systolic blood pressure and diastolic blood pressure? Systole refers to contraction, and during systole, the left ventricle contracts, ejecting blood systemically into the arteries, causing sharp rise in arterial blood pressure. So this is known as systolic blood pressure. After ejecting blood into the arteries, the left ventricle relaxes, and this is the diastolic phase when the blood returns to the heart from the venous system. So this is known as diastolic blood pressure when the blood pressure falls. So while recording blood pressure, if the blood pressure values are 120 by 76, 120 refers to the systolic blood pressure and 76 is the diastolic blood pressure. So what is mean arterial pressure? Mean arterial pressure collectively reflects both systolic blood pressure and diastolic blood pressure and is shown by the equation 1/3 of systolic blood pressure plus 2/3 of diastolic blood pressure. Next, what are the types of hypertension? Hypertension can be of two types, primary hypertension and secondary hypertension. Primary hypertension is also known as essential hypertension. Most patients with hypertension have essential hypertension, and in this type there is no identifiable cause or the cause is unknown. Whereas in secondary hypertension there is a specific identifiable cause. So there is an underlying cause for hypertension, and if the cause is treated, hypertension becomes reversible. Some of the secondary causes of hypertension are coarctation of aorta. So here there is narrowing of the aorta, and this increases the pressure in the upper limbs and causing upper extremity hypertension. Chronic steroid therapy or Cushing syndrome, in which there is excessive production of endogenous steroids, which increases the blood pressure and causes hypertension. Pheochromocytoma is a tumor of the adrenal medulla, and this causes excessive production of catecholamines, that is epinephrine. Norepinephrine is released into the circulation, and this sharply increases the blood pressure. Primary aldosteronism causes excessive aldosterone secretion. And what is the function of aldosterone? Aldosterone increases the reabsorption of sodium and water in the body. So increase fluid volume, increased blood volume increases the blood pressure, leading to hypertension. Kidney disease. Some types of kidney disease can also cause hypertension, but in most cases Hypertension increases the risk of kidney dysfunction and also can lead to kidney failure. In addition, hypertension in presence of kidney disease speeds up the kidney dysfunction leading to failure. So kidney disease needs to be treated and could be a cause of hypertension. Certain drugs and substances are also known to induce hypertension or exacerbate hypertension. For example, chronic intake of high salt increases the chances of hypertension. So several health organizations have recommended reduced salt intake below 5 milligram per day. Alcohol consumption is known to increase the blood pressure and therefore alcohol consumption should be avoided. Smoking is a leading cause of pathogenesis in the blood vessels of the heart and this increases the risk of coronary artery disease. Certain drugs and substances such as opioids and amphetamine increases the risk of arrhythmias in patients with hypertension. It has been seen that decreased potassium increases the risk of cardiovascular events. So it is important to maintain the potassium concentration in the normal range. Then there are certain drugs such as tricyclic antidepressants or serotonin norepinephrine reuptake inhibitors that are used in the treatment of depression can cause elevation of blood pressure. Certain sympathomimetic agents such as beta-2 agonists by stimulating the beta-1 receptors of the heart can cause tachycardia, palpitation, hypertension, particularly in elderly patients and with pre-existing heart disease. In order to manage hypertension, it is important to grade hypertension and depending on the grading, antihypertensive treatment can be initiated. So how do you grade hypertension? Here in this video, I refer to the European Society of Hypertension guidelines for grading of hypertension. So according to the guidelines, optimal blood pressure is a systolic blood pressure value less than 130 and diastolic blood pressure less than 85. Next is high normal blood pressure where the systolic blood pressure values range between 130 and 139 mm of mercury and the diastolic blood pressure values are between 85 and 89 mm of mercury. It is normal blood pressure. This is known as pre-hypertension stage and the person is more likely to become hypertensive in future. So lifestyle modification is the primary intervention. Grade 1 hypertension is a systolic blood pressure with a value 140 to 159 mm of mercury and a diastolic blood pressure value 90 to 99 mm of mercury. Grade 2 hypertension is 160 to 179 mm of mercury, which is systolic blood pressure, and 100 to 109 mm of mercury, that is diastolic blood pressure. Grade 3 hypertension where the systolic blood pressure is greater than equal to 180 mm of mercury and the diastolic blood pressure is greater than equal to 110 mm of mercury. So initiation of antihypertensive drug treatment can be decided depending on the grading of hypertension. So this is how hypertension can be graded and according to the grades of hypertension, antihypertensive drug treatment can be initiated. If the blood pressure values are in the high normal range, then lifestyle modification is the primary intervention. This means a diet low in salt intake less than 5 mg per day, a diet rich in fruits, vegetables, increased physical activity, avoiding sedentary lifestyle, stop smoking, avoiding alcohol consumption, adequate relaxation, sleep, yoga, meditation are some of the measures through which the blood pressure can be normalized. When it comes to grade 1, if the individual is high risk, there is presence of cardiovascular risk factors, kidney disease or hypertension mediated end organ damage, then immediate antihypertensive drug treatment should be initiated. But if the individual is low risk, there is absence of risk factors, then lifestyle modification along with regular monitoring of blood pressure, and if the blood pressure fails to return to normal within 3 months, then antihypertensive drug treatment should be initiated. Also, it is to be kept in mind that lifestyle modification is the foundation to the treatment of hypertension. So, lifestyle changes is an important component of first line therapy in all patients treated with antihypertensive drugs. Next, we move on to grade 2 and grade 3 hypertension, where immediate antihypertensive drug treatment should be initiated in all patients. So now that you have graded hypertension and you have initiated antihypertensive drug treatment, it is important to know the blood pressure treatment targets or the blood pressure goals or how much the blood pressure should be lowered. So as per the European guidelines, it is recommended that the primary objective of treatment is to lower the blood pressure values to less than 140 by 90 mm of mercury in all patients. And if the treatment is well tolerated, then the blood pressure value should be targeted to 130 by 80 mm of mercury or less in most patients. So what are the drugs that are selected for the management of hypertension? The 5 major drug classes are angiotensin converting enzyme inhibitors, angiotensin receptor blockers, beta blockers, calcium channel blockers, and thiazide-like diuretics. These drugs form the basis of antihypertensive treatment strategies. So with this, we come to the end of the topic. We have discussed the various risk factors, complications, the types of hypertension, the grading of hypertension, when to initiate treatment, how much to lower the blood pressure treatment goals, and the drugs that are used for the treatment of hypertension. So please refer to the European Society of Hypertension guidelines, the link of which is attached below. Also check out my book Case-Based Learning in Pharmacology, which is published by CBS Publishers and Distributors. If you like my video, please share, subscribe. Thank you.